and this session in particular, reducing harm through decriminalization. My name is Andrea Wu. I'm a health reporter for the Globe and Mail, and I'm pleased to be moderating this discussion today. Just before we begin, I would like to acknowledge that I am speaking to you from the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh Nations, and I am grateful to be living and working on these lands. Between January 2016 and March 2021, about 23,000 people in Canada died from apparent opioid toxicity, with these deaths driven largely by an increasingly toxic drug supply. That is so many people that national life expectancy, widely used as an indicator of a population's health, halted for the first time in more than 40 years. In Vancouver's hard-hit downtown east side, life expectancy for men actually decreased by 4 years. And this is all before the COVID-19 pandemic, which exacerbated conditions and has contributed to our deadliest years for illicit drug deaths to date. In British Columbia, drug toxicity is now the leading cause of death for people between the ages of 19 and 39. This public health crisis has prompted calls for action. As overdose deaths began surging in 2016, the federal government approved dozens of supervised consumption sites across the country. Some local governments and individual physicians are cautiously providing some pharmaceutical alternatives to illicit drugs in an intervention commonly called safe or safer supply. In cities, advocacy groups, activists, public health experts, and others have called for the decriminalization of personal possession of illicit drugs, which is what we will talk about today. If you have any questions during today's panel, please type them into the chat box, which I think you will see on your screen, and we will do our best to get to them closer to the end of the discussion. So our panelists today we're joined by Vanessa Grubin, Vice Dean and Associate Professor at the University of Ottawa's Faculty of Common Law and a member of the Center for Health Law, Policy and Ethics. Hello to you, Vanessa. Next, we have Elaine Hishka, Assistant Professor at the University of Alberta's School of Public Health. Elaine is a health systems and services researcher focused on advancing a public health approach to substance use. Welcome, Elaine. We also have Martha Jackman, Professor of Law at the University of Ottawa. Her research focuses on constitutional law, equality, and the Canadian Charter, with particular attention to the socioeconomic rights of women and other marginalized groups. And last but not least, we have Matthew Bond, Program Coordinator for the Canadian Association of People Who Use Drugs. Matthew is also a board member with Canadian Students of Sensible Drug Policy and a board member of the International Network of Health and Hepatitis and Substance Users, and a knowledge translator for the Dr. Peter Center here in Vancouver. He is a freelance writer, a drug user, and someone who has previously been incarcerated. Thank you all for joining us today. To begin, I'd like to turn it over to Vanessa, who has prepared a short PowerPoint presentation on the history of the criminalization of drugs and drug use in Canada, which will make for a good starting point for today's discussion. Over to you, Vanessa.
Stage for the talk today. So as we know, there is a long history of criminalizing drug use in Canada. Legislation criminalizing drug use began in the early 1900s with the criminalization of opioid and other drugs, but it was really in the 1960s, spurred on by Richard Nixon's war on drugs, where we really observed a focus on punishment for drug use and drug-related activities. And that was manifest in the 1961 Narcotics Control Act, which expanded the role of criminal enforcement by increasing penalties and introducing mandatory minimum sentences. Although the Narcotics Control Act was replaced by the Controlled Drugs and Substances Act, often referred to as the CDSA, that act really reinforced the prohibitory framework for drug use, including criminal penalties for simple possession. So for many years, there have been discussions and studies about the proper regulatory tools to be used with respect to drug use and related activities. And over the years, the federal government has struck various committees and commissions to examine Canada's criminal approach to drug use. The We May Committee was struck to study the broad field of corrections. And in the course of its work, it recommended a shift away from a punitive approach towards a more rehabilitative approach to corrections. The Ledane Commission, which followed shortly thereafter, had a mandate to analyze drug regulation in Canada. And it made a series of recommendations, which included abolishing criminal penalties associated with simple possession of drugs. These reports and the shift towards decriminalization has been in large part because of the harms arising from criminalization. There are several well-established and well-studied harms associated with criminalization of substance use. There's an excellent study done in The Lancet in 2016, which nicely describes the impact of these kinds of policies in terms of the harms that result. Policies, as the study explains, that are meant to prohibit or greatly suppress drugs really present a paradox. They are portrayed and defended vigorously by many policymakers as necessary to preserve public health and safety, and yet the evidence suggests they have contributed directly and indirectly to lethal violence, communicable disease transmission, discrimination, forced displacement, unnecessary physical pain, and the undermining of people's right to health. The harms arising from criminalization are numerous and often overlapping in nature. The criminalization of drug use significantly interferes with access to health, human services, and social services. People who use drugs face barriers to accessing routine care and emergency supports due to fear of police and arrest. For example, they may not seek emergency supports or emergency services in the face of life-threatening circumstances. They may not engage with health services such as HIV prevention and treatment interventions for those reasons as well. More broadly, criminalization of drug use impacts the ability to attain and maintain employment, housing, and food. So it goes well, these harms go well beyond simply accessing healthcare services and other services. The criminalization of drugs also fosters stigma and discrimination. And those harms associated with stigma are really born out of this notion of self-responsibility and putting responsibility on the individuals who are at risk. Those harms, of course, are borne disproportionately by Indigenous, Black, and people of color. The disproportionate likelihood of Indigenous and other racialized communities experiencing criminalization reinforces that stigma and reinforces intergenerational experiences of trauma, socioeconomic disadvantage, and systemic violence. Criminalization also empowers the growth of the illicit drug market. The unregulated growth of the illicit drug market has led to a rise in the contamination of the drug supply with fentanyl and fentanyl analogs. And that in turn is largely responsible for the significant numbers of opioid-related deaths in Canada. The lack of regulation of the current drug market has led to both the rise in toxic supply and also drug-related systemic violence. So these harms have, as we've mentioned, really spurred a national conversation about decriminalization. And it's important, before we talk more about how decriminalization works, to distinguish between decriminalization and legalization. So before describing the various law reforms, I do just want to spend a couple of minutes talking about these differences. So when we refer to decriminalization, decriminalization really refers to the lifting of criminal penalties associated with a certain activity or drug. Generally, it involves lifting criminal sanctions for drug-related activities, and it may be that those sanctions are replaced with a regulatory framework, might be a fine, for example. May also offer alternative pathways, so pathways to other resources, for example, offering health services or other support services. But the key here is the removal of criminal penalties. And decriminalization is distinct from legalization. Legalization, by contrast, allows certain drug-related activities to occur within a specific legislative or regulatory regime. In other words, legalization introduces a legal framework that permits certain activities. So a good example of legalization is Canada's relatively recent legalization of cannabis, which permits cannabis use within certain defined limits and circumstances. When we think about decriminalization, there's two ways that decriminalization can occur. When we think about the way that this can be implemented by a government, it can happen in one of two ways. The first is by way of a formal legal amendment, which we refer to as a de jure approach. And so under this approach, this requires a country to amend the legislation, to amend the criminal code, or in Canada, it would be the CDSA, to remove those criminal activities or those criminal penalties that are associated with that activity. That's in contrast to what we refer to as a de facto decriminalization. And under this approach, what occurs is that the criminal law is simply not applied. There's a non-application of the criminal law. So there isn't a formal amendment. Rather, there is an informal or some discretionary exercise of authority whereby offenses and penalties still exist in the legislation, but they aren't applied in all circumstances. And so we can see that, for example, through the exercise of police discretion or through some informal prosecutorial guidance, for example. So what have the calls for reform looked like in Canada? Well, there have been a range of different proposals brought by a number of different organizations. I'm just going to focus on two to illustrate some of the different ways in which decriminalization can occur or has been proposed in Canada. So the first proposal for reform is what we often refer to as the Vancouver model and was proposed by the city of Vancouver. The province of British Columbia has recently adopted a similar approach, and that is by making an application under Section 56 of the CDSA. Section 56 of the CDSA would permit the federal minister of health to preclude the application of the CDSA for certain purposes. And Section 56 has been used in other circumstances as well. One well-known example is for safe consumption sites like Vancouver's Insight Clinic. So the Vancouver proposal seeks to do several things under this exemption model. It proposes to set threshold volumes below which adults would not be charged for possession and their drugs would not be confiscated under certain circumstances. And this particular model would provide that there are no administrative or other penalties for individuals who are in possession of a volume of drugs below that particular threshold. As I've mentioned, the province of British Columbia has followed the city of Vancouver's lead and filed a similar proposal under Section 56 of the CDSA earlier this month. There are a number of expert bodies and task forces that have also set out proposals. So one recent organization is the Health Canada Expert Task Force on Substance Use. This task force was charged with providing independent expert advice on alternatives to criminal penalties for the simple possession of controlled substances. And there was a unanimous recommendation that the government, from that body, that the government of Canada should end criminal penalties associated with simple possession. In the course of its recommendations, the task force actually recommended a different approach from this Vancouver model, much more innovative and wide-ranging law reform project that would bring all psychoactive substances, including currently illegal drugs, tobacco, cannabis, and alcohol, under one legal framework. So it would bring several pieces of legislation together under one regulatory model. So those are just a couple of examples of reform proposals that we've seen in Canada. So I'd like to close the prepared portion of our panel's remarks with just a brief description of some recent litigation that has been started in Canada. 3 individuals and the Canadian Association of People Who Use Drugs have launched a lawsuit which argues that the provisions of the CDSA, which prohibit drug possession, violate a number of sections of the Charter. The thrust of their argument is that drug criminalization creates an illegal market for drugs, which is unregulated and has become lethal for many people who use drugs. And that criminalization creates a fear of persecution and stigmatization that results in people who use drugs from not being able to access medical treatment and harm reduction services. They argue that drug addiction and dependence should be treated as a health issue, not as a criminal one. So with respect to the Section 7 argument, Section 7 protects the right to life, liberty, and security of the person. The claim alleges that people who use drugs, those rights are violated because they do face this dangerous illegal drug supply that threatens their lives and health. That Section 15, the right to equality, is violated because of the disproportionate effect of criminal penalties relating to drugs on Indigenous, Black, and other persons of color. And that with respect to Section 12, which is the right not to be subjected to cruel and unusual treatment, that punishment of simple drug possession and the resulting potential for imprisonment constitutes cruel and unusual punishment, contrary to our Charter. Finally, in Canada, the Charter rights are not unlimited. The government can justify an infringement of one's Charter rights under Section 1 of the Charter. And the applicants argue that these Charter rights cannot be justified in accordance with Section 1. So with that very brief background, I'm going to turn it back to Andrea and open it to my co-panelists.
Thank you so much for that. There's a lot of information in there. I appreciate that. Matt, I was hoping to go to you next. I was curious, from your work and from your life experience, can you speak to the real world impacts of applying criminal law and punitive measures to substance use, to addiction, and what this means for people who use drugs or have addictions?
Well, not to be too sinister, but people die and people die at alarming rates. When you're somebody who uses substances and you may be dependent on substances, there's so many other health and social inequities that follow you, right? Like if you have a criminal record for a drug possession charge you had when you were 19, you went to school trying to get a job, you can't get a job. And then it's like a spiral effect. You can't get housing, and I have a very privileged view on this where I'm a white, privileged male. I have a lot of allies. But that's not the real story that we hear on the ground. Like people don't get treated unfairly because of a substance they decide to put in their body, right? And if you look back at in prohibition days, right, like it's just like, people are going to use substances no matter what, right? And this whole thing around thresholds, which is another absurd claim, because when all we have to choose from is unregulated, untested, unknown, illegal street supply, we can never know what we're actually consuming. So how can you impose thresholds on people where they may be think they're buying one thing, but they're actually getting something else? And I think, and Kaput has been very vocal and active about it, is because, we can't just get rid of people that are, buying and possessing drugs. We need to also protect people, or not get rid of people, like protect people from certain sections of the CDSA. But we also have to include the people that support those people. A lot of times people don't have access to the drug that they may be seeking in the community, and drug users take care of themselves. They really get your drugs tested. Here's all the safe using equipment. Don't use alone. And it's really wonderful to see such a great community take care of themselves. But it's really time for action, and it's time for change. And we really need to see this come from federal governments. We need top-down approaches that involve everybody from every level and every aspect and every various stakeholder to get rid of this crisis.
So you brought up a really good point about thresholds. So under decriminalization, generally people are permitted to carry a specific amount of currently illegal substances, and that would be considered personal possession, and they would not face criminal penalties for that. I do want to talk about that a little bit more, but just later on. For right now, I was hoping to go to Elaine to ask her about the public health implications of criminalizing drug use.
Thanks for the question. I think, as Matt really clearly pointed out, it is going to depend a lot on what type of regimen is implemented in terms of decriminalization. And if decriminalization is not effective and it doesn't abide by kind of like international gold standards, which is the removal of criminal penalties and not replacing them with administrative sanctions, for example. And if the thresholds are too low and it's not realistic or workable for people who use drugs, then it may not have much impact at all. If, though, we are able to put in place a regime that works for people who use drugs and takes account of the current realities of the illegal drug market, I think there are quite a few important public health implications for decriminalization. The first is that I would expect to see a reduction in substance-related harm. And this may not be necessarily a dramatic reduction in overdose, and we can get into why that is, later when we talk about safe supply and the drug supply. But I would expect to see that more people would be willing to seek support if they were concerned about their substance use and felt they needed help with their substance use. I think this would make screening and population health surveillance much easier. Right now, we really don't have a good idea in Canada how many people may be struggling with illegal drug use. And that's because people rightfully don't want to disclose to their physician or a healthcare provider to other authorities in their lives because they're at risk of, being criminalized and sent to jail potentially for using illegal drugs. And so I think if we can remove that barrier, many more people would be open to participating in surveys and also, screening and things like that. And we would actually be able to identify people that could use support and offer that support more effectively. I think too, beyond that, there's some real practical benefits of decriminalizing for the health system. Right now, when people end up in hospital, they're often unwilling to talk about their substance use. I work at a hospital that has an inpatient supervised consumption service, and a subset of patients don't want to disclose their substance use and access that service because they don't want it to be on their permanent medical record. Beyond that, I think, we've seen across the country efforts to scale up supervised consumption services more broadly. And a huge hindrance to that is the need to apply for a Section 56 exemption. And the only reason that we need to apply for those exemptions to be able to operate supervised consumption services is because drug possession is criminalized. If it wasn't criminalized, people could offer those services in a whole variety of different models. They wouldn't have to have federal approval, and they could immediately be put into action to help reduce the risk of drug poisoning fatalities, which are obviously at an all-time high in Canada. So to be honest, from a public health perspective, drug decriminalization is long overdue. It's consistent with a public health approach. And I'm hopeful that as a country, we can get to a place where we see high quality policy proposed and implemented, and that will translate into a variety of benefits that will improve how the health system responds to substance use.
Thank you for that, Elaine. Martha, you've said that the criminalization of drug use is not only a public health issue, but that it's indefensible from a constitutional law perspective. And Vanessa touched on this in her presentation earlier too. Can you speak on how that is so?
Absolutely. And really, I think it's worth actually doing a little crash course on the Charter of Rights. And Vanessa has spoken about this, and both she and Matthew have mentioned the CAPOD legal challenge. Essentially, Section 7 of the Canadian Charter protects the right to life, liberty, and security of the person. And it says that no one can be deprived of those rights except in accordance with the principles of fundamental justice. And it is very evident that the current criminal regime, and Section 4.1 of the Act in particular that criminalizes possession, violate Section 7. So first, of course, there is a risk to liberty because people who have illegal drugs in their possession are at risk of being imprisoned. So that's a very straightforward claim. But the criminalization of drugs also violates the right to life and to security of the person. So the threats to life, Elaine and Matthew have alluded to them, as did Vanessa. We have a toxic drug supply in Canada, and when you have a criminal law regime that basically pushes people into using drugs that are not in any way regulated by the state, there are deaths. In terms of security of the person, the right to security of the person, there's a physical dimension to that. So violence, ill health, and all the other ill effects that Elaine and Matthew and Vanessa have already mentioned. Mental health effects, anxiety, stigma. These are all interests that the Supreme Court has recognized as being protected under the right to security of the person under Section 7. Deprivations of life, liberty, or security, it's not an absolute blanket protection. The government can justify deprivations if they are fundamentally just. And what the Supreme Court has found is that deprivations of life, liberty, and security won't be found to be fundamentally just within the meaning of Section 7 if they're arbitrary. And it is clear, and I think that just that last PowerPoint of Vanessa's, the quote from the Lancet, pretty well makes the case. Is it necessary for the government to criminalize drug use, drug possession in order to achieve its public health objectives? Absolutely not. In fact, the means it's adopted are completely inconsistent, in fact, undermine those public health objectives, which is a definition of arbitrariness right there. The whole regime is discriminatory. that makes it fundamentally unjust within the meaning of Section 7. It's just grossly disproportionate. That's to say the benefits that we in Canadian society derive from the criminalization of drugs are really outweighed by the harms to individuals, which are grossly disproportionate. And one could argue that the whole regime is fundamentally unjust because it's incompatible with Canada's international human rights obligations around access to healthcare, equality, racism, colonialism, etc. So Vanessa mentioned that Section 1 of the Charter. So again, no rights are absolute in the Charter. The governments can attempt to justify rights violations under Section 1 of the Charter. To do that, the government has to show that the objective it's pursuing is sufficiently important. And I'm sure no one would argue that the objective of protecting and promoting public health and safety, that's an important objective, sure. But is the means that the government has adopted, so criminalizing possession of drugs, is that a rational means of achieving that objective? Absolutely not. Is it a minimal impairment of the rights, the Section 7 and other charter rights of people who use drugs? Again, absolutely not. Now, we do have some earlier jurisprudence around cannabis, the Malma Levine case, where the Supreme Court found that exemption power that Elaine referred to, Section 56 of the Act, it really permitted the government to justify the criminalization of cannabis at the time, because the court argued, okay, there is this safety valve in Section 56, exemptions can be granted, and that makes the law minimally impairing. And I think the experience in Canada over the last decade, and especially since the COVID pandemic, makes it really clear that Section 56 is absolutely not functioning as a safety valve. It may be if you live in a city like Vancouver or a province like British Columbia, where there's some political will to address the problems of criminalization. You know, the availability of a Section 56 exemption is an important one. But in most parts of the country, as you well know, there's absolutely no appetite for anything that looks like a Section 56 exemption. I live in Ottawa, and our mayor and chief of police historically has been very antagonistic to the idea of a Section 56 exemption in Ottawa. So the idea that the availability of these ad hoc exemptions, very complex process, lots of political pushback would be sufficient to justify the regime, absolutely not. So long and short, you have it there. And as I say, the Canadian Association of People Using Drugs have made the argument in a much more detailed way. But I would say that at this point, with the existing jurisprudence of the Supreme Court of Canada and the public health record that Elaine has described and the harms that Matthew and Vanessa have described, that is why I say that the regime is simply no longer defensible from a constitutional point of view.
Very good. Thank you so much for that, Martha. Matt, did you briefly want to add to that?
Yeah, and I just want to add to that because, you know, we have been doing a lot of work with the Dr. Peter AIDS Foundation around splitting and sharing with inside overdose prevention sites and supervised consumption sites. So essentially, you know, we formed this working group. Health Canada had this extensive consultations on how to make overdose prevention sites better, how to make them supervised consumption sites better. And one of the biggest things that came out of it is, well, we can't split and share drugs when we go to these sites. And that's a very fundamental aspect of drug using culture, right? So, you know, we did a survey. I think we interviewed 140 people. We got, you know, like, we got all the answers that we really knew. We did we created a document, a policy brief, a protocol template. And now in the new application to apply for a subsection 56.1 exemption, you can apply for splitting and sharing, which is like a huge constitutional win because essentially that is a form of trafficking that they are now allowing within these sites. Because no matter what, if there was an exchange of goods or whatnot, but if I handed Andrea drugs, I could be charged for trafficking, right? So I think there's big wins, there's little wins, but like say if we were to get say if one of these city applications went through and they applied for splittling and sharing in it, that's a form of trafficking, and that's what Capote's really fighting for, right? Because we know if it's just the user that gets criminalized, or sorry, if it's just the user that kind of gets this alternative form of support or treatment, then who are they going to go after next? And that could be people that are engaging in small and low level dealing just out of necessity for their day-to-day well-being, right? And they're not the ones that deserve to be locked away and thrown away the key either. So I think, you really got to focus your time and energy on importing, exporting, manufacturing, some of these more criminal organization tasks that are, really more about the profit than anything else.
Thank you for that. And I do want to talk a little bit more about that shortly too, when we talk about if there is an optimal model for decriminalization. But just before we move on to that, we've talked about some of the reasons why there's the feeling now that decriminalization is long overdue and a necessary next step. But we also hear a lot of concerns, and there's a lot of reticence to this. For example, one of the concerns that we often hear from people who are critical or opposed to the idea of decriminalization is that this could lead to increased drug use. And there are also public safety concerns and public disorder concerns. I see Matt pulling out his hair as I say this. The mayor of Vernon, for example, Victor Cumming, recently said that it takes away a significant tool of police to manage people who are using in public. And I'm sure that will come across as sort of callous to some people, but there are people who are concerned about public drug use, public disorder, and how decriminalization would factor into that. Vanessa, would you have any thoughts on that?
Sure, happy to weigh in on that. So, as Elaine and Martha and Matthew have all discussed, there are significant harms associated with criminalization. And I think the focus really needs to be on addressing those harms that individuals are experiencing. And there's little to no question that decriminalizing will decrease substance use related harms, that this will solve or will help along the way of addressing a really serious public health crisis that we are facing in this country.
And sure, so, it's not a silver bullet.
Yeah. And so while, there are different viewpoints, I think it's really important that we emphasize the harms that arise from criminalization and the need to adopt a public health approach to addressing those harms. The criminal law is not the appropriate tool to be addressing simple possession. And in fact, we've seen even the Canadian chiefs of police have come out in support of decriminalization. We need to shift these resources towards public health initiatives and away from policing. So that would be my response to those critics. Long overdue. We really need to shift towards a public health model. And there is ample evidence to support that approach. And indeed, even the Canadian chiefs of police have supported that shift in approach.
We are sort of racing through this panel and we don't have a ton of time left, but just briefly, Matt, did you want to add to that as well?
Yeah, and with the most respect, Vanessa, I completely agree, but I think instead of always a public health approach, it needs to be a human rights approach, right? Like people who use drugs have the right to consume the drugs that they may want to consume, right? You know, like, I don't know how many times I have been forced on medication that I didn't want, but if I could have just had my one anxiety medication a day, you know, I would have been talking to girls, I would have gotten my homework done, I would have just been like the me. I just wouldn't have been living in that constant fear. And that's how I grew up. So, you know, like when you kind of like don't know who you are, you find something that, you know, really kind of helps you dig down to what that is, and then it's taken away because it's illegal. And then even say, then I went and got a prescription, but then there's that stigma that follows you, right? And I think that's a real important point to mention around decriminalization and whatnot. It's like, you know, we're never going to get rid of stigma unless we get rid of decriminalization, and that's where a lot of the harms, and hopefully we can start switching away from harms and look at the benefits of substance use.
Thank you for that. Martha, could you speak to how the criminalization of drug use and drugs impacts marginalized communities differently?
Yes, and again, if you'll forgive me, as someone who's coming at this from a constitutional law perspective, I'll start by saying that the disparate adverse impacts that I'm going to mention are all also contribute to the fact that the legislation is unconstitutional because it clearly violates equality rights guarantees under Section 15 of the Charter. So most obviously, criminalization affects people who use drugs and who depend on drugs. There is a lot of evidence around the disparate impact on people with diagnosed and undiagnosed mental health disorders. I thought the quote by the Mayor of Vernon is great because it makes the point. People who are homeless, obviously, Indigenous and racialized people, and that is a very much at the heart of the Caphood challenge. And I'd like to mention also the HIV Legal Network has done some really fantastic work recently, documenting in extremely an in-depth documentation of the disparate impact of criminalization on women. And again, the impact on pregnant women and mothers in particular. And, you know, we've alluded a few times to the stigma and the concern that if you disclose your drug use, the state will come down. Well, you can imagine that in the child welfare context. And there is also a lot of evidence, and Matthew's just alluded to that, to the impact on youth. So criminalizing youth, youth who were in the child welfare system or aging in the child welfare system at a real disadvantage. And again, the disproportionate impact of criminalization in terms of the actual disadvantage around health, safety, well-being, and stigma. These are all grounds to find the regime unconstitutional.
Thank you for that, Martha. Elaine, I'd like to go to you and to ask you how decriminalization fits into our current context with the toxic drug crisis. Like if we were to magically decriminalize nationally tomorrow, what changes might we expect? And would this make a difference in our overdose crisis?
That's a good question. I think, you know, there has, as Vanessa mentioned at the start, there has been many jurisdictions internationally that have liberalized their drug laws for one or more substances. And so the evidence is still building in this area, but generally speaking, what we can conclude is that the rates of a use of a certain substance in society, whether it be cannabis or something else, really aren't well reflected in the drug law that applies in that jurisdiction. So in some cases, you may have a country that has fairly liberal laws or decriminalized possession, and use might be low. In other instances, it might be higher. And so we know that the drivers of like use rates, it's other things, it's not the law. So when you change the law, I wouldn't expect like all of a sudden that we would see like a significant increase or decrease in substance use, because I do think there are a lot of other factors that contribute to those rates. What we would what we should recognize is that it's fundamentally important to decriminalize, like for all the reasons mentioned. It's counterproductive to public health. It's unconstitutional. Frankly, drug laws are racist. They're applied discriminatorily. We can go on and on and on. And we need to do that. But we also need to recognize that in decriminalizing, we won't necessarily end the drug poisoning epidemic that we're facing. And that's because the real root of our current surge in mortality that we are seeing in more and more regions across the country, and certainly have been living the horror of in Alberta, where I'm from, since at least 2014, is really due to a fundamental shift in the illegal drug market. Before, we had, in many jurisdictions, a large supply of prescription opioids that had been diverted and were circulating in the illegal market. And, in Alberta, that was certainly the dominant opioid for sale for a long time. Efforts to crack down on the prescription opioid supply were well-intended, in the sense that there was rising rates of overdose, and regulators felt that this was potentially a solution to that problem. But what ended up happening was the illegal market just moved and adapted to address the unmet demand that was left by reductions in supply of prescription opioids. And so now across the country, we're seeing illegal drug markets completely overwhelmed with novel synthetic opioids that are highly unpredictable and highly toxic. And so decriminalizing minor drug possession or minor drug trafficking is not going to change that fundamental fact. It will help people seek support. It will help them have a better shot in life in general, because they don't have to deal with a criminal record. It will reduce the risk of overdose, post-incarceration, when people who may be using substances are incarcerated. They go through a period of abstinence, and then if they relapse on release, they're at very high risk of overdose. So it will help in those ways, but it's not going to address the fundamental problem, which is the contaminated illegal drug supply. And so in tandem with decriminalization, I think it is time nationally, and certainly the Health Canada expert task force that Vanessa mentioned, has advanced this. It's time to have a conversation about legal regulation, and, maybe just making ourselves completely subject to the whims of the illegal market, and watching, increasing mortality to the point where life expectancy is declining. Maybe it's time to have a conversation about how can we be more effective in our approach to drugs, and what would a careful system of legal regulation look like, and how can we reduce harms, because all signs indicate that the situation is only getting worse. And frankly, without fundamental structural change, it is really hard to imagine going back to a place where we have a much lower overdose or drug poisoning mortality.
Thank you so much for that. So our governments, our federal governments, our provincial governments are nowhere close to considering a regulated model. However, there are discussions about decriminalization. There are growing calls for it. There are sort of patchwork approaches. There are the Section 56 exemptions. So in the absence of regulation, maybe Vanessa, I'll start with you. I'd like to use our last 10 or so minutes to talk about, if we were to decriminalize, what are the important things that we would have to consider? Is there an optimal model? How would this work for the most number of people?
So I think in terms of an optimal model, it's an excellent question. I think it's something that a lot of experts have been giving a great deal of thought to. Rather than speaking to the sort of the optimal model, I think there's some features of the regime change that we really need to ensure are present. And so first and foremost, it's really critical that when we begin this law reform project, which is long overdue, that we ensure that people with lived experience are at the center of that conversation. Law reform really needs to be responsive and speak to people who are living this reality. So that's first and foremost feature of a law reform model. I think the second really critical aspect of law reform in this area is ensuring that there is a national approach as opposed to a piecemeal approach. And Martha has mentioned this in her comments, having Section 56 of the CDSA and trying to carve out pieces of the puzzle, small exemptions here and there, is not going to solve this problem. We need a national approach. We need the federal government to decriminalize nationally and not take a regional approach, whether it's city by city, as we see from the Vancouver proposal, or on a province by province basis. We really need a national approach to decriminalization. So that's the second feature that I would strongly advocate for. And then finally, and I'll open it to my other panelists, it's critical that any approach to decriminalization needs to be evidence-based. So critical that the government is responsive to what is happening on the ground, how people use and share drugs, and the evidence that we have about the harms that result from the current criminal model. So as I've mentioned, there's different models that have been proposed, some more modest than others, but those are three of the features that I would strongly advocate for as we start engage on this law reform in this area.
Thank you for that. Matt, you've co-authored a preprint titled How to Decriminalize Drugs. And so I feel like you might have some thoughts here.
Yeah, and this was led by Dr. Alyssa Greer, and it was a great paper. And so I won't get too much into it, but, first, we got to look at, okay, so what are the reform objectives? Is it de jure, de facto? What is the legal framework? Will the offense remain in criminal law? And these are some of the more kind of models that I think will resonate more with us and resonate more with the population. But eligibility criteria to which the response applies. So person-based criteria, age, population, previous and concurrent offenses. So what age groups does the model apply for? What groups will the model apply for? So what populations? How will previous offenses be handled? And I think this is something Canada hasn't done very well with in terms of, trying to get their old cannabis, criminal record expunged. Not saying we're doing horrible, but, it's not easy, it's not cheap. So there should be one real kind of just overhaul of anybody charged with cannabis records. Place-based criteria, where does the model apply or does not apply? So this could be like next to schools or things like this. We just seen in Scotland that it took them a long time to open the first Scotland's overdose prevention drug consumption room because it was too close to a school, and they actually won. Now they're finally open now, but these things need to be taken into consideration. And then another one, drug type. Which drug types are included in the model? Are these going to include all novel psychoactive substances? What are the amounts of drugs that define possession for personal use? And I think, it really, if we can start having open conversations and maybe start, sourcing drugs in compassion clubs and, building trust within the community, I think this is something that can be very lucrative for not just drug dealers or drug service providers, but, people that want to work and help people use the safest way possible, right? Because I think, we're gaining more and more traction with harm reduction, and having these conversations will really help get people on our side. Also, another table we had around kind of like actions taken available in lieu of criminal penalties. No actions taken, Deterrence strategies: caution, notice or warning, fine issued, restriction to freedom of movement or contact with people, seizure or suspended of privileges, for example, driver's license or passport, community service order. And then there could be therapeutic strategies, referral to education, referral to social program or health program. And then I'm not going to talk about enforcement strategies because I don't think they have any role in talking about decriminalization. And that's my own bias, and I will state that for the record.
Thank you for that, Matt. So we have just under 5 minutes left. I wanted to turn to Elaine next. One of the big talking points about decriminalizing is that it's a recognition that addiction is a health issue, that criminalization creates more harm than benefits. To that point, I mean, do we need to build up our treatment systems before we can effectively decriminalize?
No, I don't think so. I think, we definitely need to build up our treatment systems. We need to have treatment be widely accessible. We need to have all of the evidence-based modalities available to people as soon as they want or need them. But that should not be something that, is a prerequisite for decriminalization. Decriminalization is a fundamental injustice, and we can't, just because governments have not invested in treatment systems, should not be used as a reason to continue to infringe on people's rights and to saddle them with a criminal record that lasts a lifetime and continue to negatively impact their health. So I think the short answer is no. And I think also we need to recognize in shifting from decriminalization, because the majority of drug charges that are levied in Canada right now are for minor possession of drugs. And so if we were to eliminate that, we could potentially save tons of financial resources that then could be shifted into health systems to support people who are using substances. And so I think that in alone is a reason to proceed with decriminalization, prior to any changes to the health system. Another thing that people should recognize is the vast majority of people who use drugs don't have an addiction or a substance use disorder, and they don't need treatment. And yet we continue to infringe on their rights by criminalizing them for, casual or infrequent non-medical use. And so I don't think that is a justifiable position. And it does disappoint me when that is kind of held up as, something that needs to happen before we decriminalize, because it's not required. And certainly decriminalizing will likely help us to shift resources into the health sector and build up treatment systems.
And to piggyback off that quickly, it should be housing first, right? Because, you have these for-profit company building these beautiful little rooms and, huge rooms, but that's not the reality, because when they leave, we just need more sustainable and affordable housings for some of the most marginalized and vulnerable members of our community, where they have a cell phone, where they have a landline, where their infectious disease doctor can get a hold of them, where their probation officer can get a hold of them. Because when people get in trouble, it's usually not really related to it is related to the first offense, but when they end up in jail, it's related to, okay, I'm going to the store and I forgot to call, and then they get picked up on a breach because they were supposed to be on house arrest or something like that, So it's like we need to really implement structural changes to our criminal justice system.
Martha or Vanessa, did you want to add either one of you?
Agreed.
Yeah, agreed. Absolutely. Should not be a precondition. This is a human rights issue, and we do need to shift resources, and we can do that, but it should not be a precondition to law reform in this area.
I appreciated that line from Elaine saying that governments won't invest in treatment systems should not be a reason for us to infringe on people's rights. And it's also worth noting that there is growing public support for drug decriminalization in Canada. There was an Angus Reid poll it came out in February, I believe, that found that 59% of Canadian adults who responded, this was, I believe it was 5,000 people, but 59% of respondents nationally were in favor of removing criminal penalties for drug possession. It was a majority in every province except for, I believe, Saskatchewan and New Brunswick. But anyway, so I note the time. We are right at the end of our session, and I wanted to, on behalf of the RSC, I wanted to thank our panelists today for their time and for the thoughtful discussion. And thank you also to our viewers for choosing to spend the last hour with us. My name again is Andrea Wu, and I hope you all enjoy the rest of today's sessions. Thank you so much.